I would like to introduce Dr. Raphael Kellman. He is the author of the Microbiome Diet, Matrix Healing, and Gut Reactions. We're going to be talking about hypothyroidism, NTIS, and low thyroid hormone in the central nervous system in children with autism. 3 forms of low thyroid function commonly found in children, but routine blood tests are missing. Thank you for joining us today. I'm so happy to be talking about this.
Well, thank you so much for having me.
I know that autism is, definitely increasing a lot right now. And, in autism, is autism one disease, or are there different subtypes or things that create the state that we're actually calling autism today?
Well, that's a good question, and that's actually a point that I frequently make, that there are really many different causes of autism, many different pathways that lead to this diagnosis, this condition we call autism. But there's 2 points that I think we need to be very clear about. One is that there isn't one cause. There's usually a combination of multiple causes. I look at it like a web of causes that coalesce that then lead to this final diagnosis that we call autism. But there are many webs of causes that can take a child down that unfortunate path. But it's important to distinguish these different causes because they could be very different one from the other. There's one child may develop this constellation of symptoms and problems that we call autism because of X, Y, and Z. And another child may develop something quite similar, also diagnosed and called autism, this constellation of symptoms. But it could be very different. The set of causes could be very, very different, or the web of causes could be very different one from the other. And then there could be a third child who had totally different issues, but it also led to this constellation of symptoms and problems that we call autism. So it's very important to distinguish the different pathways that can lead to autism because they need to be approached differently. And it makes the treatment protocols that much easier to offer and to accomplish the goals you want to accomplish in helping these children get better. Because there are so many different treatments out there. Some are valid and some have efficacy. Others have less efficacy. But how do you know which ones to choose? There are so many different treatments that are being offered. Well, how do you know which ones to choose and what do you start with? Well, the first step is to try to create to subcategories and to know what category each child falls in. And one could be very different from the other. So, like, for example, one child may be a gut microbiome as the main cluster of causes. That would be kind of what we call like the gut or the microbiome child. And then there's others that could be due to toxins, and others that could be caused by different metabolic pathway defects and toxins and associated with the problems in these pathways. So it's very important to separate one child with autism from the other and not to mix up the different categories.
Now, you mentioned that there's all these different treatments out there, and when you do go on the internet, you find thousands of them. How do we actually know which one is the best one for our child? Because you mentioned, that there's all these different causes. I mean, I know that's the question we get all the time. It's pretty confusing, and sometimes it's often scary.
Sure. Well, that's why first of all, you have to take a good history. You have to really understand what are the main symptoms and when did the problems occur? What preceded the decline? Were there infections? Was there a gut problem? Were there vaccines together with some upper respiratory infection? What about the pregnancy? Was the pregnancy uneventful? Was it vaginal delivery? Was it a C-section? What was the health of the mother? All of these factors must be taken into account. So after going through a proper history and doing the basic screening of blood testing, you could then distinguish one category from the other. So one child, you just know that it's a gut microbiome is the primary problem, the gut. It's gut-centered. The problems that the child is experiencing today is likely mediated mostly, but not completely, from gut issues, from gastrointestinal issues, or issues in the microbiome, the ecology of bacteria that are protective and supposed to be our right-hand man, so to speak, in keeping us healthy, but it can easily become less functional, and if it's not giving us that protection, we're very susceptible to widespread issues. And then there could be other children that have a different constellation of symptoms. For example, some may have, when you do blood testing, you see clearly that there's a lot of toxins. You can screen, you can do some blood testing for toxins, heavy metal testing that could be done through urinalysis. It could be provoked testing, or even routine testing, but it's better to do provoked. So some you can see that there's clearly a toxicity issue. Others you can see based on their testing that there's genetic issues, genetic variants, and then they fall into the category of nutrigenomics, that they may have methylation pathway challenges, or their ability to produce methyl groups and their ability, which are very, very important for neurotransmitter production and hormone production and metabolism and immunological function, etc. It could be compromised, their ability to produce glutathione, a key antioxidant, and cysteine, compounds that play a critical role in detoxification, could be compromised. So then you know that these children, their primary issue could be various biochemical pathway challenges, like the methylation pathway. So once you sort out the history and the basic testing, then it gives you an idea of what category the child likely falls in. But it must be made very clear that most of the time there's significant overlap, and many children could really fall in a few different categories. But it's important to know what is the main category, the main overall overarching issue that has led to this problem we call autism.
A lot of families have probably never heard of what microbiome means,
Sure.
that they might be newly diagnosed, and that might be a new word to them. You keep mentioning that. Is there a way to kind of define what that is so they understand
Sure.
more about it?
Sure. The microbiome is an incredibly large collection of bacteria, a huge ecology of bacteria that are found within our gut, within our intestines. And these are protective, friendly bacteria. They play an incredible role in keeping us healthy and maintaining a balanced and a healthy immune system. They play a huge role in inflammation, and a significant role in gastrointestinal function and in brain health. So the microbiome, these bacteria, contrary to the way we used to understand bacteria, are very, very important for our health. Without the microbiome, human life would cease to exist. So the problem with so many children with autism is that their microbiomes are unhealthy. This ecology of bacteria that's supposed to be protective and keep us healthy falters. It's not as healthy as it should be and could be for various reasons. And that leads to secondary gut issues. The gut wall becomes somewhat permeable to partially digested foods and toxins. It can also adversely affect the immune system. It can adversely affect the endocrine system, and absolutely it has a significant impact on the health of the brain. And when the microbiome is unhealthy, this can certainly lead to neurological changes and can definitely be playing a significant role in the development of autism. So keeping the microbiome healthy, getting the microbiome healthy is a very important piece of this puzzle of getting to the core issues and helping these kids. The microbiome frequently is a foundational issue. Now, for some, as I said, it's the category that they fall in. But I can say that just about any category that a child falls under in terms of the etiology of his or her autism, nevertheless, healing the microbiome plays a very, very important role in helping children with autism improve.
Now, you mentioned, why the microbiome many times so far, and I have such a better understanding, and I'm sure the people listening have a better understanding. What kind of symptoms would we be looking for in children with autism if there is if the balance is messed up?
Well, look, they may have gastrointestinal symptoms like constipation, bloating, discomfort and pain, foul-smelling stools or loose stools or constipation, as I said, or they may have no obvious symptoms at all. So you could have problems in the microbiome and not know it, and you may not see these symptoms in a child. So that's why it's important to test and to see if there is a significant problem in the gut and the microbiome, even if there are no symptoms. Now, if there are symptoms, of course, the testing will be more extensive. It's still very important to do some basic testing of the gut and the microbiome, irrespective of what category of autism we're dealing with.
Okay, and then you talked a little bit earlier about the metabolic pathways. What are metabolic pathway problems?
Well, many children with autism have methylation pathway problems. The methylation pathway is a very, very important pathway in our physiology. It's a linchpin for health, and abnormalities in the methylation pathway can absolutely lead to many, many different diseases and health issues. This pathway plays a very important role in the production of methyl groups. Methyl groups are a carbon and 3 hydrogens, critical compounds for hormone production, for neurotransmitter production, brain chemicals. Very important for the immune system, very important for overall health, and very important in turning genes on and off. So methyl groups need to be constantly made, and many children, if not most, with autism have significant problems in producing a sufficient and necessary amount of methyl groups. Additionally, this pathway is very important for the production of glutathione, critical antioxidant and redox cell regulator. This methylation pathway is very important for the production of cysteine, which plays a very important role in detoxification. And also, when the methylation pathway is unhealthy, it can lead to an overproduction of ammonia, which is a toxic compound to the brain. It can lead to an overproduction of homocysteine, which is a neurotoxin. It can lead to significant sulfur metabolism abnormalities, including the overaccumulation of sulfites. So this pathway really has to be well balanced. Additionally, they could be producing a deficiency in BH4, which is a very important compound for brain health and neurotransmitter production, and it also quenches ammonia. So many things can go wrong in this pathway. By the way, low thyroid could contribute to a methylation pathway dysfunction. Heavy metals like lead, mercury, and other toxins can further challenge the methylation pathway. And then, of course, each one's genetics have different, many people have different genetic variants, and they're meaning that they're making perhaps weaker enzymes or their enzymes are too powerful and it causes an imbalance in these metabolic pathways, leading to either an underproduction of compounds or an overproduction of certain compounds, leading to an imbalance in a very, very critical pathway, which has adverse consequences for brain health. So it's very important to test the methylation pathway and to treat it properly, because frequently you'll find problems there. Now, again, if the child is, let's say, a metabolic pathway type of a child, meaning that the cause of their autism, or I should say the category that they fall in. Remember, there isn't just one cause. There are a web of causes that they fall under. We may label the methylation or biochemical pathway abnormalities. Nevertheless, even in someone who has a totally different constellation of symptoms and issues, nevertheless, a basic evaluation of their methylation pathway is very, very important.
Now, what does toxicity do to kids? And the biggest question is, how do you remove it?
Well, toxins have a direct effect on the brain. Toxins have an effect on enzymes. It can affect these the methylation pathways and other very important biochemical pathways. Additionally, toxins affect the endocrine system, especially the thyroid. And it's well known that many of the toxins that have been implicated as causes of autism, one of their mechanisms of action, and perhaps their primary mechanism of action for some, is thyroid disruption. They're called endocrine disruptors in the sense that they're everywhere. They're endemic in our environment, but they don't necessarily have to be in our environment at high levels to have detrimental effects, because the endocrine system is so susceptible to even low levels of chemicals. So we call these endocrine disruptors, and it includes phthalates and PCBs and dioxin and perchlorate and lead and mercury and dioxin. I think I mentioned dioxin. Also BPA. There's just so many chemicals in the environment, flame retardants, and they're finding more and more that can wreak havoc on the endocrine system, specifically the thyroid. So these chemicals, as causes of autism, absolutely have to be detoxified. But some of these children have difficulty detoxifying them, and especially if they're affecting the thyroid, and frequently it does, we must heal the thyroid and, of course, also detoxify the chemicals. But if you don't heal the thyroid, it's very difficult to detoxify. Based on my work, and I've treated hundreds of children with autism, I find 75% of children with autism have some degree of low thyroid, and a large percentage of them have low thyroid because of endocrine disruptors. Not all of them, but a large percentage. So 75% of the children that I see with proper testing, I have just diagnosed with an underactive thyroid, and I think that the research supports that it's very likely that these numbers that I'm finding are probably universal. The problem is the routine thyroid blood testing frequently misses the diagnosis, and that's why, and it can even create contradictory elements, and the thyroid numbers can be just very bizarre, and they don't seem to be typical. So a lot of doctors just kind of throw up their hands and say, well, I don't know, it kind of looks, you can't make heads or tails out of this. And all too often, the children are not being diagnosed with low thyroid because the tests are so elusive, because you can frequently get seemingly contradictory results. But if you look deeper and you understand the mechanisms of why these thyroid is dysfunctional and what aspects of the thyroid signaling system is dysfunctional, you'll be able to better read and understand the tests. But invariably, deeper testing must be done to properly understand this wide epidemic of low thyroid in children with autism.
Hey, you mentioned the thyroid test and really testing in a deeper level is if, let's say, the people listening right now want to go to their doctor and they're like, yeah, I want to go get my child's thyroid test checked. Maybe they were told that their thyroid was fine. What do they ask their doctor for in regards to
Well, in the very least, you need TSH, you need total T4, total T3, free T4, free T3, reverse T3, thyroid antibodies, anti-TPO antibodies, anti-thyroglobulin antibodies. These are the basics, in my opinion. But I go even further. I do what's called Trh Stimulation Test, which I feel is really necessary in every child with autism if the routine tests are not clear or they're not making a definitive diagnosis. This test, called the Trh Stimulation Test, really should be used, and it's something that I've been speaking about at numerous conferences and really trying to get the word out that you can't rely on routine thyroid testing to properly make the diagnosis. And frequently you do need the test called the Trh Stimulation Test, to be able to better understand what's happening with what I call the researchers actually call the thyroid signaling system, because the problem may not only be in the thyroid, the problem could be in the pituitary gland, which controls the thyroid, or the hypothalamus, which controls the pituitary. But either way, all of this is a chain that leads to thyroid dysfunction. But you won't, if you just do routine testing, you may miss all of this. But with the Trh Stimulation Test, you're much more likely to see is there a thyroid problem, what the problem is all about, what the problem is about, where the source of the problem lies. Now, additionally, you can have a more complex issue where you can have what's called non-thyroidal illness syndrome, which is called NTIS, and I believe many children with autism have this less known condition called NTIS, but that does lead to, or translates into, I should say, low thyroid function.
And so is this a blood test, though, when you're talking about the Trh stimulating test?
Yes, the Trh test is a challenge test. We inject a hormone into the vein called Trh, which stimulates the pituitary to release TSH. And then we do a blood 25 minutes later. If there's a high amount of TSH, even if there's a normal amount in the blood, then we know that the thyroid is low. Because if the thyroid is underactive, the pituitary should, and usually does, but not always, will produce a lot of TSH to try to wake up the thyroid so that it produces more hormone. But you may not see it in the blood. But if you could look right into the pituitary, or if you just inject Trh, which causes this TSH in the pituitary to be released, you can see that high amount, which is an indication that the thyroid is low. But sometimes we find a very low or a diminished output of TSH, and that's what we call non-thyroidal illness syndrome, is that the pituitary and the hypothalamus in these kids is going into a down regulatory state, and that's what we call NTIS, or non-thyroidal illness syndrome. And why this happens is really a complex question with a very, very complex, it's a very, very complex subject.
Well, you mentioned, injecting for the stimulating test. Is there any risks on injecting that? Is there anything that parents should be afraid of?
Absolutely. Look, there's a risk in putting on a Band-Aid, but I have never seen a complication. I've done it on hundreds, if not already over 1,000 kids. I've done this on tens of thousands, maybe 60, 70, 80,000 adults. I've done so much. I could write the textbook on this. So I know that it's a safe test, and I know that the test is so critical to better understand the issue of hypothyroidism or NTIS in children with autism, so that they can be properly diagnosed and properly treated, because it can make a huge difference in the lives of so many children.
And the regular doctors or doctors that are specializing in autism, like, I've never heard of this test, and I'm excited to learn more about it, and I'm sure many of the listeners are. How do we get our doctors to test for this, and are there clinics to go to or labs?
I mean, look, no, a doctor has to do it. It can't be done in a lab. I've been wanting to teach more doctors how to do the Trh test. I've taught some. I like to teach many, many, many doctors how to do this test. I think it's critical to do. Especially if the routine blood testing is not picking up the diagnosis, then, but unfortunately doctors don't know how to use it. It used to be used commonly, but it kind of fell out of vogue erroneously in 1996, 1997, I believe. But I knew that this is an important test, and I was trained in learning how to do it. 2 studies that were published in peer-reviewed journals that came to the same conclusion that I came to back in 1997, that in fact the Trh stimulation test should be used, and we shouldn't just put it into the shelves of medicine and just rely on routine testing. The studies did show that frequently in certain populations, patient population, that the Trh test is absolutely necessary, and both of these research papers came to the same conclusion, that, if the routine thyroid test missed the diagnosis and you suspect and there's a chance that the thyroid may be low, that the Trh test could be very, very beneficial and should be done. And that's exactly what I've been doing in children with autism. And I can tell you it's changed many, many lives.
Well, what an exciting finding. I mean, I know many listeners are, I'm sure if they're like me, they're going to be on Google right after this, and we're going to try to figure out how to get this test done and how to contact you especially. Now, my next question for you is, how does neurological inflammation and autoimmune deficiencies play into kids on the spectrum?
Well, again, that's another category of causes, and neuroinflammation is definitely something that we see in many children with autism. For some, it's more pronounced than in others. We draw blood we look for this condition. You have to do it to check for markers of inflammation, like interleukin-6, tumor necrosis factor alpha, and many others, to see if there's a lot of inflammation and likely brain inflammation. And then you could look at indirect evidence. I believe if there's very high reverse T3, it's a hormone that actually counteracts the effects of T3, one of the thyroid hormones, there is a greater chance that there is inflammation. You can measure lipid peroxide levels, and there are other ways of evaluating for damage done to the cells because of free radicals and inflammation. And based on all of these lab results, then you can actually treat accordingly. So, for example, if you do find that there's high levels of tumor necrosis factor, interleukin-6, CRP, other biomarkers, usually, but not always, but usually the source of that inflammation is in the gut. And we must heal the gut and improve the gut bacteria. But there's even specific probiotics that can directly target these inflammatory markers and reduce these markers of inflammation. So it is, nowadays, there's just so much to do, so much good medicine that can be practiced based on the knowledge of the microbiome that can not only reduce overall inflammation in the brain, but specifically target specific markers of inflammation. because when these markers of inflammation are high, it's associated with neurological degeneration, neurological inflammation, and the symptoms of autism.
Now, how do infectious diseases like Lyme, viruses and things like that affect kids on the spectrum?
Well, I do find that a percentage of children with autism have Lyme. For some, even though we're detecting it, doesn't mean that it's actually playing a role. For others, I believe that it is. I'm not a big fan of using antibiotics for Lyme unless there's significant symptoms. But otherwise, I improve the person. They improve the immune system. There are a number of different herbs that can be used to keep the Lyme in check and co-infections. But I think improving the host, improving the terrain, the person, improving the gut, the microbiome, the thyroid, improving the nutrigenomics goes a long way in helping patients and these children overcome infections like Lyme if it is playing a role in the etiology of their autism.
Now, do children, with just developmental issues in general, have thyroid dysfunction? I know you said, I think the percentage you gave was 75% that you've
yes.
just came across in your practice.
Yes.
Is that pretty typical in general from all the other doctors you're talking to that know about thyroid?
Well, I think just about every doctor who treats autism believes that thyroid is playing a role. But when it comes down to it, in each individual child, if they can't find it on the blood testing, a lot of them are reluctant to actually treat, even though they know that they should be finding something, but they're not. So they focus their attention on other things. But I think by and large, the doctors who know agree that the thyroid plays a significant role, and they look very, very closely as well. I've spoken at many, many conferences, including the Autism Research Institute's think tank, on this very topic about better testing to properly evaluate for thyroid dysfunction. And there's general agreement with this approach that I've taken.
Now, let's shift gears a little bit here. Can you talk a little bit about celiac disease and gluten sensitivity?
Well, sure. There's no doubt that a percentage of these kids with developmental disorders and autism have gluten intolerance. Some actually have celiac, which are lesions in the gut. But most have different forms of inflammation and colitis in the gut and the intestines. I mean, the ones that are in the gut category, I should say. I wouldn't say that every child with autism has lesions in the gut, but those that are in the category of a gut child with autism, let's say, in that category, yes, there's a chance that they may have some form of colitis and inflammation. They may also have signs of celiac, but a much larger percentage of children with autism actually have gluten intolerance, which means that gluten grains causes some form of inflammation in the gut wall, or it causes some intestinal permeability problem and contributes to gastrointestinal dysfunction, microbiome issues, and ultimately brain dysfunction as well, central nervous system dysfunction as well.
Now, we haven't really mentioned this yet in this talk, but sometimes people talk about sugars and yeast. Does any of that play a role in anything that you're talking about?
Oh, absolutely. The overconsumption of sugar definitely plays a role in causing problems in the gut, causing problems in the microbiome, can have a detrimental effect on the brain itself. And yeast overgrowth in the gut is just another type of problem that we tend to find in children with autism. Whether it could be parasites, it could be yeast, it could be bacterial overgrowth. Absolutely. We find these types of problems in children with autism.
And so what we're feeding our kids, do you believe it plays a big role in this?
Absolutely. We have to change their diets, and we have to change our diets. We have to change America's diet.
Absolutely. I 100% agree with you. I think I believe, at least for me, that my son was here to teach me to live a better way. And I've learned so much just from the research, I've had to do for him. And I'm sure a lot of other parents are feeling the same way. Now, do other doctors in the field of autism agree with your perspective?
Oh, I think many do. I think we all have our own unique approach. There are some doctors that really believe that it's all about the gut. There are others that focus more on the nutrigenomics, on genetic variants that the child may have, and the methylation pathway. There are others that are focusing on Lyme disease and other infections. There are others that are focusing on parasites, and they're doing very, very extensive treatment for parasites. There are many different roads to Rome here. I think that it's important to try to come up with some plan of action so that you're not all over the place and doing 100 different things at the same time. That's why I like to categorize autism into a number of different subcategories, and then it will guide us as to what tests, more extensive testing should be done first, and what treatment should be done first. How do you prioritize when there are so many treatments to offer, when there are so many treatments out there? How do you know what to use first for your child? How do you know what is the most important issue or most important issues that needs to be addressed? And how do you know what sequence of treatments one should follow? Well, that's why it's so important to subdivide and categorize each child so that you know what type, so to speak, of autism we're dealing with. And that will lead to a different path than what you may come up with in another child. And when I say another path, I mean another path in terms of the deeper testing and also the treatments. And in what order are you going to offer these treatments? How do you prioritize these treatments?
Well, it's interesting you talk about subtypes and subgroups. I've been thinking of it like that for several years with my own son. And, I'm not a doctor, and so it's just my own opinion. But, and I know that autism is not like cancer. However, when we look at the cancer world, there's subgroups of cancer, and there's divisions of how you're going to treat this particular cancer and how you're going to treat that particular cancer. And there's certain doctors that are more specialized in this one versus the other. And I just feel what you're talking about is, so ahead of the game when it comes to the autism world, because I feel by listening to you, it's exactly what I've been feeling from my son, is that, not all autism is created equal.
That's right.
If it was, why would some children react really well to a diet, or why would some children really react to certain biomedical treatments, and why don't we have a one size fits all? Because our bodies are so different. And so
that's right.
Everything you're saying, for me at least, it makes a lot of sense. And hopefully for the families listening, it's kind of like, everyone has a different puzzle and everyone has different pieces. And I think that's why it's so crucial to have doctors like you out there talking about this, because when you ask the question, how do we know what tests to do? How do we know what treatment? As parents, we don't know. We rely on doctors like you to kind of navigate us, through that.
That's right.
And so this is a billion-jillion-dollar question that I'm going to ask you. In your opinion, is there a cure to autism?
Again, I don't think there's one cause. I think it's numerous causes. I don't think one issue causes autism. I don't think that it's a gene defect. I think it's multiple causes that coalesce to create a web of causes that lead to this constellation of symptoms we call autism. I think looking for a cure is misunderstanding the nature of the disease and what it's really all about. And I think it's misunderstanding our physiology. And because if one would really understand our physiology and the nature of disease in general, we will realize that looking for a cause is trivializing the extent of the problem that we're seeing today in terms of chronic health issues. It also, I think, misunderstands the nature of disease. By and large, disease is not caused by one problem, by one little gene defect or by one particular cause. That's rare. Most diseases, most of the chronic issues that we are plagued by today are due to multiple causes, where it's a combination of our genetic background, plus the environment, plus many, many other variables that, as I said, that kind of come together to lead to this phenotype, to this product, this outcome that we call disease. So I don't believe that there will ever be one single drug that will cure the disease. But I do believe that we will be able to cure autism the deeper we understand physiology and the true causes of disease.
Well, I know a lot of parents right now probably had a tear in their eye when you said that, because I know I was getting teary-eyed as you were talking, because that's what we want. We want our kids to be better, and we want them to have the best quality of life. We want to have them be able to live on their own when we're not here one day. And, honestly, it feels as though even though autism has been around for a very long time, we're really just understanding it a little bit better, and doctors like you are really the pioneers of trying to figure this out for all of our kids today and all of our kids, for the future. So, I was getting a little choked up when you were talking, truly, because, that's what we want for our kids. We want them to be better. We want them to be healthy. You can call it cured. You can call it, pink, purple, blue. I don't care what label you want to call it. I just want our kids to be better. And absolutely. And so when you're talking and doctors like you out there that are not giving up on our kids, that's what parents out there want to know, and that's what parents want to know, that
we'll never give up. We will never give up, and we will keep on trying to make these kids better.
And that's what we need. We need doctors like you to do that. Now, what are 3 things a parent can do right now to help their children on the spectrum?
Well, the first thing is, don't settle for routine testing. Just because, your doctor has said, oh, the thyroid is normal, we did blood testing and everything came out normal, don't believe it, because the routine blood tests could miss it. And even the reference ranges are very, very questionable. So in the very least, make sure that your child receives all the tests that I recommended in this talk, and be careful about the reference ranges, because let's say a TSH reference range could be from 0.5 to 5. The ideal range may be 0.8 to 1.9. So be careful with reference ranges. Don't assume that the tests are normal because your doctor said that they were normal. That's number 1. Number 2, because you're going to be facing so many different treatment options, remember that what's good for another child may not be what's good for your child. And even though your child and your friend's child, unfortunately, both have autism, they may be very different types of autism. The constellation of causes, the web of causes, could be very different from one child to the next. So therefore, there's treatments that may have helped your neighbor's, your friend's child, may not be the treatments that will help your child. What we need to figure out is, what category does your child fall into? What type of autism does your child have? And based on that, it will be a lot easier to determine what deeper testing should be done and what types of treatments should be done, should be used, and in what order, so that this will really sort things out for you. It will clear the confusion, and then you'll be able to proceed. Otherwise, I see so many parents, they're virtually paralyzed. They don't know where to begin because there's so many treatment options out there. There's so many different claims about this is beneficial and that's beneficial. And even if many of them are true, that doesn't mean they're going to be right for your child. And how do you can't do all of them. You can't do all the treatments. Well, which ones are you going to choose? Well, it will be a lot easier to make that decision if you first categorize and subdivide the autism one from the other. Again, because there could be a number of different types of autism. That's the second point. And then the third is that, I do believe that we can make great progress in helping kids with autism. Anyone who just gives up and gets too focused on the diagnosis, I think is being unfair. I don't even like these diagnoses, autism and ASD and ADD, and it's somewhat unfair because it kind of locks people into a prison of a diagnosis. It's better to look at disease and even health as well as processes rather than disease as a thing. And these processes can be improved and they can be changed. And the more of these processes that we improve and that we change and that we never give up, irrespective of the age of the child, the more likely it is that we're going to see more benefit. And with more benefit, we'll see more benefit yet again. So never give up. And I know most are not, because I never give up. And sometimes I've seen amazing results when initially we didn't see good results and other doctors didn't see good results. Sometimes you have to change your orientation. You have to start with a different type of treatment first before you can see the benefits of a treatment that maybe you've done in the past, but you didn't see good effects in the past. So there's still hope, and I've seen great results. I've seen, many children actually become mainstream. They've actually, have ended up in regular classes and they're doing very well. Others did not improve that much, but still improved significantly. And they're more independent and the significant reduction in symptoms. They're, to a great degree, enjoying their lives. So I think for each child, we should have our own, and the child's parent should, of course, needs to weigh in on this, set goals of what are we trying to accomplish. And I think first and foremost is to reduce symptoms so that the child then can then have an opportunity for the brain to improve and function. So reducing symptoms is also a very important goal. So the bottom line is that there is always hope, because I've seen significant improvement in so many children when so many people have given up. So even many doctors have given up hope, especially the more conventional ones, because they were labeled with a diagnosis. And sometimes it's best to forget about the diagnosis and just improve the various processes. And then we will see more and more improvement.
And do you believe there's an age cap on our children getting better and better?
I never believe that. I never believe that there's any ceiling over us. I believe that we can climb higher and higher, and we should never give up. You never know what tomorrow is going to bring. Tomorrow we may think about this totally differently, or some new solution will come to our minds, and that will be the right thing for this particular child. So you never know, because I've seen all kinds of miracles. So never give up.
I believe you have been so inspirational to the families listening today. How do they find out more about you if they want to get in contact with your practice?
Sure.
If they want to find your books.
My website is kelmancenter.com. Again, my name is Raphael Kellman. I wrote a book called The Microbiome Diet that could be purchased on Amazon. So it's kelmancenter.com.
Can you spell that for them?
Yeah, sure. It's KELLMAN center.com.
And then all of your books are probably in the bookstores and on Amazon, I imagine?
Sure.
Wonderful. Oh, my goodness. I am so grateful for you taking the time. I know your schedule is so busy, and I know the families they're just so grateful as well. So thank you so much for everything you're doing for us.
Oh, my pleasure. Thank you so much for having me, and I hope this changes lives.
Absolutely. It's one day at a time, right?
That's right.
All right. Thank you, Dr. Kellman.
My pleasure. Thank you.